staffing is a problem here. Imagine 16-bed ICU. We have only 3 critical care nurses.
Wow, 3.
And the rest are auxiliaries who are helping them. So ideally, there should be a critical care nurse at every shift because people are on ventilators, people are on oxygen, but we don't have that numbers.
The team lead at the center, Dr. Emmanuel Ahiableh, outlines some of the challenges the center faces. He continues by calling for government's immediate attention.
The first 2 cases of COVID-19 in Ghana in March were brought here and they were kept at the 4 ward. But there was a time we thought, this being regional hospital, we need to, scale up and build a bigger facility. And this place was built in October. And as a result, we are under pressure. So, like I said, we need more equipment. That's to upgrade this place so that we can give optimum treatment to our patients. Equipment such as monitors, patient monitors. We need oxygen. Oxygen is also very important here. We also need logistics for testing.
That was a conversation with the team lead of the COVID-19 ICU at the Rich Hospital, Dr. Emmanuel Ahiableh. He outlined some of the challenges the center faces as he appealed to government to come to their aid. As of January 27, 616 new COVID-19 cases had been recorded, pushing the country's active case count to 3,813. The facility at the Rich Hospital still manages some of the critical cases. I asked Dr. Emmanuel Ahiableh if things have improved since our January 18 conversation.
I wouldn't say things are getting better because we still have backlog of patients who have tested positive waiting to be brought to our COVID ICU, which has 16-bed capacity. So things are not getting better.
So in effect, things are getting worse. You told me on the 18th that you need medical supplies, you're running out of oxygen, the beds are getting full day in, day out.
Yes, I mentioned that the other time you came here. This hospital was not designed for infectious disease such as COVID-19, where they demand high volumes of oxygen. So because of that, the area we've designated at the COVID ICU, which has 16-bed capacity, plus the 8-bed capacity for holding, who are also severely ill, as awaiting the results, cannot cope with the oxygen, the number or the amount of oxygen we need.
My next question was this.
If things continue this way and if government do not come to your attention, would there be dire consequences?
What you are saying there, if things don't improve in the next few weeks, I think the few staff who are working there, they'll be breaking down, they'll be reporting sick because of the stress and the overload of work. And also, it's going to affect the patients. The quality of care will not be the best for us. If things continue this way, we don't have enough doctors running the shifts at the hospital. We've requested for some medical doctors to augment the numbers here, but up to now we haven't heard from the authorities. So we are running 24/7 for now. So if things continue like this, like I said earlier, it's not going to work for the staff. Medical supplies are going to run out. The equipment we are using, like the monitors we are using, cardiac monitors, because we are using them often, they are breaking down and sometimes they don't function well. So we need accessories of these equipments. For now, the 16 beds have monitors for each one of them. They were donated by the Ghana Health Service.
The answer he gave to my final question made me shiver.
We are seeing high numbers of pregnant women who are testing positive. And as I speak now, 5 of them are on an admission at our COVID ICU. One condition became critical this morning. She had tested negative as at yesterday. So she delivered by herself on Sunday. So she has been rushed the main ICU for intubation and for further management.
Away from the Rich Hospital, I managed to ask what authorities are doing about the situation at the facility.
Availability of oxygen is not Ghana alone. It's a global challenge for critically ill patients, especially with COVID. But what the most important thing that they continue to expand, escalate the amount of oxygen that's available, not only to Rage, Ghana East, etc. We are putting up new oxygen plants to be able to generate. We are buying a lot of cylinders that are booming. So we continue to expand.